Hey everyone, my name is Dr. Galatea Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about sarcomeres, series versus parallel. This is one sarcomere. These are two sarcomeres in series. 4 sarcomeres in series. So series means that they are adding onto each other like a chain or a line. The more sarcomeres there are in series, the longer the muscle physically gets. When you stretch consistently, you will gain more sarcomeres in series. This increase in the physical length of your muscles is going to result in greater range of motion as well as faster contraction velocity. So it's directly related to the speed of contraction. If I stretch, I am going to increase the number of sarcomeres in series, and physically my muscle gets longer. So of course, if I have tight quads and I stretch and I get a longer muscle, I will have more range of motion. It's literally longer. And because there are so many actin and myosin filaments working together, if I continue to add sarcomeres in series, the more I have, the time for that muscle to contract is going to decrease. And I'm talking about velocity. That's exactly why our velocity increases when we have more sarcomeres in series. Now let's talk about sarcomeres in parallel. These are two sarcomeres in parallel. So parallel means that these sarcomeres add to each other, not lengthwise, but in thickness. These are 2 rows of sarcomeres in parallel. It's the same thickness as the last one, but it's just 2 rows that happen to be in parallel. This is still 2 rows in parallel, just more in series. This is 4 rows of sarcomeres in parallel. Okay, you get the point. Now, the thicker the muscle is, or how many sarcomeres there are in parallel, that is, it means that we get a greater cross-sectional area. And with more cross-sectional area, we have more force. So more sarcomeres there are in parallel, this directly correlates with the amount of force that a muscle can produce. So when we strength train, we must then get more sarcomeres in parallel. That's what's happening on a physiological scale. The more I strength train, the more sarcomeres in parallel I get, thus the more force I get from it. The muscle on the right is then stronger than the one on the left. Series versus parallel. Is there one that we want our patients to have more of? Realistically, wouldn't we want our patients to have both? If our patient is limited in muscle flexibility, we're going to tell them to stretch. And in turn, we will have more sarcomeres in series, which is going to help with improving range of motion, of course, and result in a faster contraction velocity. If our patient does not have the strength in their glutes or quads to stand up, I'm going to have them strength train so that they can develop more sarcomeres in parallel to get more force. I wouldn't say that series versus parallel, that one is better than the other. It really just depends on your purpose. Are you trying to get more force? Or are we trying to get more range of motion and maybe increase the speed to which our muscles can work? So if you really think about it, we want all of the above. We just need to find out as a PT which one of these 2 is lacking with our patient, if not both, and help our patient improve on it. If you enjoy material being taught this way, check out our courses at sptwithme.com when you're studying for the NPTE.